Hi friends, welcome to Pharmacoesia and Vertic Made Easy for second year medicals. Today we are going to discuss about anti-leprosy group of drugs. So firstly, what is leprosy? Leprosy is an example for chronic inflammation caused by an acid-fast bacilli. That means they gives positive Zeal-Nielsen staining. The bacteria which cause leprosy is Mycobacterium leprae. So that belongs to Mycobacterium group. So based on clinical type, there are two forms of leprosy according to WHO. So let's move on to classification of leprosy. There are two types of classification. First one is WHO classification of leprosy, and the second one is Ridley-Joplin classification. What are they? WHO classification and Ridley-Joplin classification. So firstly, let's move on to multibacillary and paucibacillary leprosy. They are short written as MBL and PBL respectively. These are under WHO classification. There are two subtypes, multibacillary leprosy and paucibacillary leprosy. So what are the difference between both of them? In multibacillary leprosy, it is most serious form of leprosy. The paucibacillary leprosy is clinically less severe compared to multibacillary. So what is multibacillary leprosy? In multibacillary leprosy or MBL, there is bilateral extensive skin lesions with lepra bacilli in each skin lesions. So when we check for lepra bacilli, the smear will be positive for bacilli. So these are 3 points. The first one is smear will be positive for lepra bacilli. So smear should be taken from bilaterally extensive skin lesion with the lepra bacilli numerous in each lesions. That's the most severe form of leprosy, that is multibacillary leprosy. Now moving on to paucibacillary leprosy or PBL. It is less severe form of leprosy. So what are their characteristics? First one is smear will be negative for bacilli. So and single or few skin lesions will be seen. Here bilateral extensive skin lesions, but here single or few skin lesions only will be seen. Okay. Then what about nerve involvement? In paucibacillary leprosy, there will be predominant peripheral nerve involvement. And in multibacillary leprosy, there will be least nerve involvement. Okay. That's regarding WHO classification of leprosy. Then let's move on to Ridley-Joplin classification of leprosy. This classification is based on cell-mediated immunity of individual. Okay. So there are 5 subtypes under Ridley-Joplin classification. They are short written as LL, BL, BB, BT and TT. Which is the most severe form? The lepromatous leprosy is the most severe form according to Ridley-Joplin classification. So in lepromatous leprosy, the cell-mediated immunity of individual will be least. That's about LL. Then moving on to borderline lepromatous. So then the least clinical features will be on tuberculoid leprosy. That means the cell-mediated immunity of the individual will be very high. So in between these two extremes, lepromatous and tuberculoid leprosy, there are 3 stages. Okay, they are borderline lepromatous and borderline tuberculoid. In between these two, there is another one, that is simply borderline. So there are 5 times according to Ridley-Joplin: LL, BL, BB, BT and TT. The strongest one is lepromatous leprosy and the weakest one is tuberculoid leprosy, in which cell-mediated immunity will be very higher. So let's combine both of this classification. According to WHO, first 3 groups of Ridley-Joplin classification is belonging to multibacillary leprosy. Okay, LL, BL and BB. Then the last 2 forms, that means weakest form, borderline tuberculoid and tuberculoid leprosy, both of them belongs to paucibacillary group of leprosy. So that is regarding classification of leprosy. So that's brief introduction about leprosy. Now let's move on to drugs used for leprosy treatment. So firstly, classification. The classification for anti-leprotic drug is, first group is sulfone group. The example is dapsone, the typical anti-leprotic drug. The example is dapsone, which is short written as DDS. Then second group is phenazine di. The example is clofazimine. So first group is sulfone group, example is dapsone. Then second group is phenazine di. It belongs to a di group. The di has so many significance in following discussion. So don't lose that word. The example is clofazimine. Then anti-tuberculosis drugs also used in leprosy treatment. They are rifampin or rifampicin. Both are similar. And another one is ethionamide. Ethionamide. These are two anti-TB drugs which is used in leprosy treatment. And other examples includes ofloxacin and minocycline. There is one typical regimen for TB treatment which is least important. The regimen is ROM regimen. Rifampicin, ofloxacin and minocycline. That's about ROM regimen. Okay, ROM regimen. So regimens will be discussed on next video. So let's move on to individual discussion of each group of drug. Firstly, the typical drug is dapsone. So dapsone is also short written as DDS. So the full form is diamino diphenyl sulfone, DDS or dapsone. The mechanism of action is similar to sulfonamide group of antibiotic. They basically inhibit the folic acid synthesis pathway. So they are inhibiting the first step of folic acid synthesis. Sulfonamide group mechanism of action is earlierly we discussed about in our videos. So the mechanism of action is they basically inhibit the conversion of para-aminobenzoic acid, which is a precursor form of folic acid, which is going to convert into dihydrofolic acid and further into tetrahydrofolic acid. There are two enzymes involved. The first enzyme is folate synthase in first step and the second enzyme is folate reductase. Our drug dapsone is basically inhibiting the folate synthase enzyme. So they are relatively weak antibiotic, so they are bacteriostatic. So it's regarding dapsone. Then moving on to clofazimine. Clofazimine belongs to phenazine di class of anti-leprotic drug. Clofazimine belongs to phenazine di group of anti-leprotic drug. So we earlier told that di has very significance because clofazimine, the mnemonic for each and every point of clofazimine is starting with D. Okay, phenazine di. Firstly, moving on to mechanism of action. The mechanism of action is the bacilli, that means leprobacilli, die due to drug DNA complex. The drug binds to DNA and form a complex and inhibit template function of DNA. Okay, inhibit template function of DNA. What is template function? On DNA replication, there will be forming of replication fork and the parent strand is acting as template. So that function is inhibited by our clofazimine di. So that belongs to phenazine di class. The mechanism of action is bacilli di due to drug DNA complex inhibit template function of DNA. Okay, that is comparison of both mechanism of actions. Then moving on to pharmacological action, both of them are bacteriostatic agents. Okay, then pharmacokinetics and dynamics, both of them are having similar points. So our common 4 points we are earlier discussing about in our videos. They are administered orally, absorbed after plasma protein binding, metabolized in liver, excreted in urine and small quantity through feces. That regarding pharmacokinetics and pharmacodynamics, the clofazimine also belongs to same. Administered orally, metabolized in liver, absorbed after plasma protein binding, excreted in urine and small quantity through feces. That's regarding pharmacokinetics and pharmacodynamics. Then moving on to adverse drug reaction and uses. So what are the uses of dapsone? Earlier we told that dapsone is typical drug. So it is used for both possibacillary and multibacillary leprosy treatment. So it's one of the use. Then clofazimine. Clofazimine has two roles. First one is leprosy, which leprosy treats. It treats only severe form of leprosy, that is multibacillary leprosy. And another use is lepra reaction, because clofazimine has an anti-inflammatory action. Lepra reaction will be discussing on our coming videos. So leprosy and lepra reaction is use of clofazimine. Then what is the adverse drug reaction? Dapsone belong to sulfone group. So the adverse drug reaction is sulfone syndrome. Okay, and another adverse reaction is G6PD deficiency hemolytic anemia. Due to deficiency of G6PD, there will be excessive hemolysis forming anemia. Anemia is example for adverse drug reaction of sulfonamide group. Similarly, here also another anemia, G6PD deficiency anemia. Then moving on to clofazimine adverse drug reaction. Adverse drug reaction of clofazimine is starts with D. So it is a dye, so it causes discoloration on exposed part of clofazimine. That's first one. Then it belongs to dye category, so it causes pigmentation of conjunctiva, cornea, body fluids like urine, tears, sweat. So it's a basically belonging to dye category. So it dye due to drug DNA complex inhibit template function of DNA, and it adverse drug reaction is discoloration of exposed part and pigmentation of cornea, conjunctiva and body fluids like urine, sweat, tears, etc. Then moving on to third important drug, the drug is rifampicin. The drug is rifampicin, which belongs to anti-tuberculoid drug. The short form for rifampicin is HRZDS, that is anti-TB drug. So in our earlier video, we discussed about anti-TB drugs in detail. So the first drug was isoniazid, the second drug is rifampicin. The standard short form of rifampicin is R in regimens and all. So the mechanism of action begins with R. The mechanism of action is rifampicin or rifampin is inhibition of RNA polymerase. So thereby it inhibits RNA synthesis. Okay, that's regarding rifampicin mechanism of action. Then moving on to pharmacological action, they are bactericidal, that means they are stronger. Then coming to use, they are anti-TB drug and anti-leprotic drug. So use is TB and leprosy. Then pharmacokinetics and dynamics, administered orally, absorbed after plasma protein binding, metabolized in liver, excreted in urine and small quantity through feces. That's regarding pharmacokinetics and pharmacodynamics. Then moving on to adverse drug reaction, the first three drugs of anti-TB, HRZ, three of them will be causing same idea, that means hepatitis formed due to hepatotoxicity, and it's also belonging to category of dye similar to clofazimine, so it also causes colored urine or colored body fluids. That is adverse drug reaction of rifampicin. So that's regarding anti-leprosy drugs. So it's end of discussion of anti-leprosy drugs.